There are many ways to prepare PRP and PRF, and some people say fluid PRF is the second generation of PRP, which is true, and I will tell you why. And there are many myths and rumors, and I want to clarify things packed with scientific evidence, how to do things in the best way that your patients get the maximum outcomes. So when you have a PRP or fluid PRF, you have all heard of activation. Some people recommend to use calcium chloride, calcium gluconate, or thrombine for that. But it's very important to know when this is required and when not. Because in your skin, you just have a specific amount of receptors. And when you activate the platelets, they open up immediately and release all the growth factors immediately. But these growth factors have a fairly short half-life time. So when they all come at the same time, the receptors are blocked and you will not get the maximum outcome. Whereas when you follow the pathway of the endogenous, the body's own activation, they are getting activated over time. And then they can act much more powerful because they will be present for a longer time frame and the receptors will be free again to work with them. But that this works, you need some special characteristics of your fluid PRF or second generation PRP. You should not have any anticoagulants inside, because when you have a look on the clotting cascade, at the beginning of this clotting cascade, calcium is required. And calcium is in the blood, so it will clot. But when you have an anticoagulant there, this anticoagulant captures the calcium, the citrate, and then you need to add it. But the problem is when you add it, the platelets open up immediately. So best practice is to use a PRP or a second generation PRP called PRF that has no anticoagulant, and that gets activated endogenously when it meets collagen fibers. And then more or less 300 growth factors are getting released.